Hello, I'm Jay Wish, Clinical Professor of Medicine at Indiana University in Indianapolis, Indiana. Welcome to this program titled Updates Abound in Hyperkalemia Management. Joining me today are Robert Toto, Professor of Medicine at Southwestern Medical Center in Dallas, Texas, and Jerry Yee, Professor of Medicine at Wayne State University, Detroit, Michigan. Welcome everyone, welcome to our guests. As we are all aware as nephrologists, hyperkalemia is a common and serious clinical problem that can be life-threatening. Only 2% of total body potassium is in the extracellular space, so even small transcellular shifts of potassium can have dramatic effects on the serum potassium concentration. The kidney is responsible for maintaining potassium balance. 90% of filtered potassium is reabsorbed by the proximal tubule, and net potassium excretion is determined by the balance of potassium secretion by the principal cells and potassium reabsorption by the intercalated cells in the distal tubule and early collecting duct. Reabsorption of sodium by the principal cells under the influence of aldosterone creates a favorable electrochemical gradient for the secretion and ultimately excretion of potassium. Other factors which influence that gradient, such as urinary ammonium and urine flow rate, will also affect potassium excretion. Almost all causes of chronic hyperkalemia are associated with impairment of renal potassium excretion. On the other hand, most cases of acute hyperkalemia are due to endogenous or exogenous potassium loads, which may overwhelm even normal renal potassium excreting ability. Let's start with Jerry. What are some of the circumstances in which an elevated serum potassium level may not represent true hyperkalemia?
Jay, I'd say that there are several, the most common of which is what we call a pseudohyperkalemia from exuberant fist clenching. When the venipuncturist asks the patient to give blood, they may pump up their forearm to the extent that the blood in the forearm is higher than the blood in the rest of the body. So the blood in the tube will actually be high, but it's actually just the forearm blood. So the patient is safe. There are other causes that are intrinsic, and that would be such as a dissolution of a hematoma or a person with gastrointestinal